Welcome to another Digital Health Report from Stockholm.
And today we have a very important guest, Eduardo Leyva, who is a general manager for AbbVie in Sweden. Eduardo started his career being a student in industrial engineering. Then he joined AbbVie in 1999, worked across South and Central America, got promoted to being general manager in Portugal, and last month was appointed as a general manager for Sweden. So warm welcome, and it's a pleasure to have you here.
Tack så mycket.
Congratulations on the promotion.
Oh, thank you so much.
So
I'm extremely excited.
Thank you. So can you tell us a bit why AbbVie, being a biopharma company, decided to enter into digital health?
Well, you know, it's very important for us to work with the patients. Nonetheless, I have to say that we don't like to call them patients. They are just persons living with a disease. So as persons, it's very important for them to be completely digitally connected. And therefore for us to be able to interact with them, to reach them, and to actually make a difference in their lives is very important to be and to work on digital healthcare and on digital innovation.
Just to follow up, how do you see digital health changing biopharma industry?
It's a big game changer, I will say. Why? As I was saying, we want to interact with them, but it's not only interacting with the people that has a disease, with the patient. It's also interacting and favoring and allowing for the whole system to have a completely different approach towards health. Why? It's important for us to have a connection and a clear link with the physicians that are taking care of these persons, but also with the hospitals and also with the payers. And at the end of the day, they are all looking, also ourselves, we are all looking at the patient, so he should be in the center of all of our discussions. And this is why it's so important to have all of us around him. And the best way to do it is through digital technology.
So I understand the concept on the top level, but can you give some examples of current initiatives AbbVie is taking part in when it comes to digital health services?
Of course I can. One kind of simple example, Parkinson's disease, and probably for the people that has the disease or that know someone that has the disease, they can understand the burden that the person is having with the disease. Burden in terms of not being able or not being very comfortable in getting outside of home, getting into the hospital, getting to physicians. We are having a program, we are running a program currently in Karolinska Hospital where the patients having this condition, they don't have to go to the clinic. Through technology, from their home, they can interact with the physician, with the nurses, and they are going to be followed up. They are going to receive the adequate treatment that they require for their condition, even having adjustment to the dosage of the product that they should be receiving to be in control. So it's like that we are doing, and this is the difference that we want to make.
So you already see the benefits of such kind of activities on the patient's life?
We definitely see it. We have several testimonies from patients saying that they are that they see the difference, that they are extremely eager to share what is their new situation, their new condition, because it's not anymore kind of the crippling disease. It's more like I'm being taken care in an integral way, kind of respecting my way of living and my life and my normal life. So I'm not anymore a diseased person. I'm a normal person that happens to have a condition. So it's completely different.
So what kind of challenges does AbbVie face when trying to introduce digital solutions or digital health solutions in the market?
I would say that they fall into two big categories. The first one is kind of the relation with the stakeholders. Another kind of basic example. Physicians, in most of the contexts, are being paid by the number of patients that they actually see. So I'm going to see you, and this is going to be one patient, and then going to see you, and so it's kind of the way they are recognized in terms of the work that they are doing. With digital technology, this is going to disappear in a way, because I'm not going to actually see you anymore in my consultation, in my hospital. I'm actually going to receive a report saying how you are performing, what are your needs, and so on. So it's going to be completely different. So the system, the whole system, needs to completely walk away from the traditional ways of thinking. And this is the first one. The second one is data privacy and data management. We are all extremely afraid of having our data in the clouds, everywhere, so you can have access to my profile in Facebook, in LinkedIn, etc. But this is kind of what we are intended to be sharing with. Now, a condition, if I have Parkinson, is probably not something that I would like you to know. If I have HCV, for instance, that we have a product now, and that we are launching a program for HCV, I probably wouldn't like you to know that I am that I have HCV. So those are kind of the two big challenges that we need to overcome in order to be successful.
So what do you do to overcome these problems, or what actions do you take to overcome them?
Very good questions. What we are trying to do is working very openly with all of the stakeholders. So the first thing is we need to be open with the patient, with the physicians, with the hospital, and convince them that it is for the best benefit of all of us. And actually, not even us as biopharmaceutical company, is for all of us as a system. The way to create something sustainable around healthcare is convincing them that this is for the best benefit of all of us. So the first and the main one is convincing all of them that we are doing it the proper way and their benefit. Of course, you can have the technicalities on ensuring that everything is confidential, password protected, and so on, but those are technicalities that are kind of normal and that are kind of already in the market and everywhere, so it's kind of not a big difference. The main one, the first one, is the main difference.
So from what we discussed now, we understand what is the current situation from your perspective in digital health, but it's always interesting to see where are we going. So what is the future of digital health?
Let me respond to that with what I consider a very clear example. Out of 100 patients per month or per year, take it in whatever period, that a hospital is seeing right now, 100% being seen by the physician, actually seen by the physician. According to some information that we have got from projects that we are running, only 10 of these 100 should be there with the physician, because they are the critical ones. They are the serious ones, and by serious I mean they are the really ones requiring for help, looking for the physician to look at them and to make whatever analysis or perform whatever process in them. 90 patients shouldn't be there. So think on that in terms of the impact for the society and for the impact for these people. They are going to the hospital for no reason. Probably I'm over exaggerating with my comment, but they are going to the hospital without any need to be in the hospital all the time that they are going into the hospital.
Great.
So thanks a lot, Eduardo, for joining us today, and thanks a lot for your nice input. And we hope to see you soon with another digital health update.
It's going to be my pleasure.